Heelift suspension boot, the gold standard for heel offloading and pressure ulcer prevention. In 1979, two orthopedic doctors determined that there had to be a better way to help prevent the heel ulcers that they often saw form, especially when a patient was immobilized. Their solution was to create what would become the first product specifically designed to prevent heel ulcers by offloading heel pressure and supporting the forefoot. Since that time, Heelift suspension boot has been improved and redesigned primarily based on the comments and experience of wound care nurses in the field. Today, Heelift maintains its reputation as the most time-tested product of its kind. Hundreds of success stories all over the world point to the trust that nurses have in Heelift. Now let's briefly review some of the features of Heelift suspension boot. Reinforced stitching along the top reduces bulk and adds to the clean design. A soft inner material cradles the calf, redistributes pressure, and provides interior grip, while a beveled fixed pad elevates the heel. An ample heel opening allows for easy inspection. Ventilation holes and an open cell foam design provide a cooler and drier microclimate. A long right tibial flap covers the shin to avoid any contact with the straps. Closure straps are soft and adjustable. D-ring closures aid in easy application. A friction-free trico backing allows the foot to move freely on the sheets, while a stiffener prevents the boot from buckling. For patients with unique needs, an extra elevation pad with attached instructions is included for use in customizing the boot. The Heelift is available with either smooth or convoluted interiors. A patient identification label is included on the closure strap. A product identification label shows patients and caregivers proper placement of the boot and provides a link to our website for further information. A separate instruction sheet demonstrates application and customization. The latex-free Heelift suspension boot can be machine washed and dried in a mesh laundry bag or pillowcase with the straps closed. Heelift suspension boot is available in 3 sizes: standard, which fits about 90% of the population, bariatric, and petite. Note that bariatric is available in smooth foam only. Application of Heelift boots. The following section covers the application of any Heelift boot, including Heelift Glide, Heelift Suspension Boot, Heelift AFO, and Heelift Traction Boot. Application of the Heelift is easy. First, remove the boot from the bag. It is ready to use right away. Open the straps and remove the spare pad. Keep the pad and instruction guide nearby. Gently position the leg into the boot, making sure that the heel is properly centered above the heel opening. Thread the adjustable straps through the D-rings and pull to tighten, attaching at a comfortable position. Preferably, there will be a small gap between the flaps that assures that the boot has not been applied too tightly. Most importantly, reach your fingers under the boot to the heel opening to make sure that the heel is properly floated. Also, test once again that the straps are not too tight. Customizing Heelift boots. The following section covers customizing any Heelift boot, including Heelift Glide, Heelift Suspension Boot, Heelift AFO, and Heelift Traction Boot. Preventing hip rotation. With the boot in the open position, peel off the paper backing to expose the adhesive on the spare elevation pad. Place the pad on the outer side of the boot, applying gentle pressure. Close the straps over the pad to keep it in position. Preventing foot drop. First, cut the included spare elevation pad in half. Peel off the paper backing from the half pad. Then, with the boot in the open position, Carefully adhere the half pad in a vertical position behind the sole of the foot. Gently position the leg into the boot, making sure that the heel is properly centered above the heel opening. Preventing Achilles tendon irritation. To offload pressure from the Achilles tendon, start with the boot in the open position. Next, flip the boot inside out to better expose the fixed pad area. Cut a V shape into the end of the fixed pad. Once done, flip the boot back to its normal position. Gently position the leg into the boot, making sure that the heel is properly centered above the heel opening. Preventing Malleolar Decubitus. To offload the Malleolar Decubitus, start with the boot in the open position. Next, flip the boot inside out to better expose the fixed pad area. Cut a portion of the fixed pad around where the ankle will rest. Once done, flip the boot back to its normal position. Gently position the leg into the boot, making sure that the heel is properly centered above the heel opening. Using heel lift boots with a sequential compression device. After applying a sequential compression device, any heel lift boot can be fitted comfortably over the SCD. The boot has been designed to provide a convenient outlet for the air tubing required. DM Systems, innovators in pressure ulcer solutions.